have a few summary notes from each of the different presentations. And I think it's worthwhile to just kind of look at the range of types of plans. Some were quite detailed, some were more general. We saw a lot of people engaging with ministries. I think what we can do now is really start to get into the details and think about what are the actual challenges that you might find with these plans, and what are some strategies that we can brainstorm and draw from your experiences in research, in policy, to try to overcome them. So just to refresh everyone's memory, we had one talking about the poor implementation of tribal health plans. And I think one of the most unique components of this presentation was this idea of developing a network of people working in tribal areas. And it had a real idea of kind of creating a movement. And I think that was really a key component. So it's knowledge translation in the context of a bit of activism. I think that was one of them. So the next one was quite a big project. You're essentially trying to argue that the health system should take on a bigger role in dealing with undernutrition. So I think this is it's a lot more than most knowledge translation looks at. It's often about a more particular issue than sort of shifting the mandate for the entire.
Yeah, in terms of even identifying the groups, we talked about like ruling governments, donor agencies, policymakers, boundary organization, and very important, the communities of practice. So the people or the group we would like to engage with, do the knowledge translation, as it's quite varied, and I think you can devise a different kind of strategy for each group and at different forums because they are very different. So
I think for this one of the things that really comes to mind is about the micro planning and thinking about what is actually possible within your organization's funding and mandate. And taking on a very ambitious project is absolutely fine, but it should be kind of thought through over the course of a timeline. So, trying to shift the mandate, you have to think about who you actually have to involve, getting, funding agencies or donor agencies involved. In India, I mean, most of the funding is through the government. So you're really going to be trying to influence the distribution of funds in the budgets. So I think this one really struck me as quite a broad one, which I think there's nothing wrong with taking on a huge issue, but I think it is something where you'd want to really think about what is your timeline here? Who are the key people you need to meet with? And what kind of buy-in do you need to make this a feasible exercise? Or are you seeking to kind of sit outside the system and critique it in a very valuable way, but not seeing yourself as
doing
like bringing together a conference room of bureaucrats and suggesting that they take on nutrition instead of ICDS is quite a big thing. So I think we need to kind of talk about the step-by-step process. And so one of the papers that you'll be happily reading tonight really pulls apart the concept of knowledge translation. I think that's what we're hearing in the room. We're not translating like this is what we know about this issue so that government just needs to hear us. This is advocacy, this is reframing a debate, this is thinking about health systems more broadly. So I think this paper you're going to read is going to really resonate, and it really challenges this idea that you can just take something and give it to somebody else like it's an object. So we'll just go to the next one, then we'll go to a series of questions. So we'll just go one more. So decentralization in Bihar, I don't know if I caught the exact description of the problem, but it's looking at how different components of decentralization are influenced by political interests. So again, it's really, I think all of you guys have really turned this idea on its head that we're going to have a finding that we're going to clearly disseminate to somebody or that we can translate. These are really complex health systems issues, and it's not an easy thing to think about a quick 3-line policy brief that will have a clear action, which is absolutely fine. It's good to tear it apart. But I do think, again, you highlighted the role of all the different departments, which Raquel had brought up, and engaging with the boundary organizations, looking at different forms of media to get these.
And also the group on zero prescription identified about the follow-ups. It's not a one-time process that it ends. I think Rajni also mentioned about the newborn healthcare, child care that came into the policy and how it was followed over and maintained, and still people follow up whether it's sustaining, going the same way that it had started earlier. So it's a continuous process.
So in all of them, I think one discussion we can have is about the idea of resistance. So we've all said we're going to convene meetings, bring people together, but a lot of this is challenging to people who have interests. And so what are some ways we can think about this issue of resisting our studies, resisting findings, resisting certain types of research, whether it's through controlling funding, or whether it's through refusing to attend things, or saying things but not doing things. So how can we engage with this idea of resistance?
And also the positionality of the researcher who's doing, putting up this workshop. So where the researcher is based. Is it the pull, the push, or in some boundary organization? I think that also is important, how the knowledge is being taken up or how it can be transformed, translated, or disseminated.
This also made me think about the idea of strategic partnerships. So you mentioned that your organization had agreed for you to come, and Keystone is being put on through the Nodal Institute of the Alliance, which is linked to the World Health Organization, and having this type of critical mass, it can help. It can alienate some, and it can really help access other spheres. So influence is messy, and just because you do great research and you're really smart doesn't mean everyone will listen. It may help to be partnered with somebody who has a different type of relationship. And it may harm other types of communication platforms. So these things are, worth thinking through, and you have to be strategic. That links to another of the kind of challenges to the knowledge translation world, is about, who are the policymakers, and sometimes it's the people at the very bottom, that kind of street-level bureaucrat. So I think several of you had ideas of reaching communities, disseminating widely, which, is a lot harder. There's a lot more strategies and linguistic, literacy, all these things. But if those people are the ones that ultimately control access to these. So we'll just go back to some of these questions. I think these are just to provoke thoughts about what you presented. So you don't have to respond to every single one, but I think some of this came through, and some of it, wasn't as prevalent. But the idea of when to communicate about the knowledge, how to communicate, and who to communicate with. So I put up this idea of a stakeholder analysis towards the end, and this is just a formal way of doing what you're already doing naturally, but it can help just to kind of really sit down with a team, brainstorm all the different stakeholders, and then think about them as, institutions, as people. They have their own relationships and dynamics. They have funders to deal with. They have voters to deal with. They have all sorts of different pressures on them, and really just map out, okay, how can we engage them in the most useful way? And how can we get them to engage each other? So just kind of this idea of stakeholder analysis, there is literature on it. There's the idea of doing network analysis, where you see, who can access new groups, and whether you can kind of create these pictures of dots connected by lines, where the big dots are the most influential ones, and the darker colored dots are the ones who are most interested in your research, and the lighter colored dots are most likely to ignore it or be hostile. You can do all sorts of fun things with these, but it's just a formal way of doing what we always do, but it can be really helpful, especially at the beginning of a project, to think through who we can encounter and how. So just go through a little bit more. So thinking about who should do the communication. I think we always assume that the onus is on us, but sometimes we're not the best at it. So there's ideas of knowledge brokers, which is the second reading that you'll do tonight. And it's looking at an initiative in Burkina Faso to actually hire and train a specific person who's 100% a knowledge broker. And it takes a very conventional view of knowledge. It thinks about translating it like giving a gift and somebody accepts it and there you go. But it is quite interesting just to hear how they trained this person. And it can be a strategy if your study is a little bit more maybe straightforward, or it can be quite useful. Not necessarily going to work in some of the ones we had presented today. I think in the paper you'll read tonight, they do hire this person from the beginning, but they see them as they're not a researcher trained in the methods or anything, but they're really good at communicating. And maybe, they don't mention in the paper so much, but maybe that person has some influence or connections, or you can think maybe their spouse works in the ministry or something. You can think about these people in a specific way, but bringing them in from the beginning makes them more able to discuss the issues. And it also highlights that these processes are not peripheral to the study. They take so much work. So having somebody who's full-time communicating, networking, meeting people, it's quite useful because a lot of times we don't budget our time for these activities, and then it could get pushed to the side, and then you do a big dissemination at the end, and everyone's surprised by these results, and it doesn't always work. So it's a good idea to think about the time. Yeah. So then we can also just mention the last one. What about funder priorities? For each of your presentations, think about who you think is going to be funding this work, and then how would that funder influence your knowledge translation? Well, I think I think it's, the funder who's funding the research may have a way of doing knowledge translation. Yeah. They often ask for you to describe your strategy even when you're applying for the funding. But how does it affect your translation strategy? If you have a corporate social responsibility funder, will that affect what you can say? Will it affect how you say it? How, would that come up? Or if you're funded by the government, or if you're funded by Bill Gates or whoever comes and funds you, what will that have an effect on your KT strategy? So we'll just put up the last one. We'd seen this diagram earlier today. So just to think about for each of your groups, which of these models was most relevant to your strategy? Are any of us using pull efforts? Do the policymakers ever ask for the things that we want to do? It sounds like everybody's taking a project that I feel the policymakers would prefer if maybe we didn't talk about. And I think that's one of the strengths of our research, is we can bring in these marginalized voices, bring up these issues in the health system, but do it in a way that is productive in some way. Because I don't think out of the four, any of them would have been seen so much as like the government saying, we need to learn about this, here's some money, please tell us more about how we're failing to serve tribal people. And I think this is the pull one, would probably be one of the easier ones to engage them. So, but model B, if the research users have asked for the research, D also would have its values, but in D you can also encounter that the research user could be they could be resistant, they could be, it requires different skills and different approaches. And I mean, each model is just one part of the picture. I'm sure at different stages in the project, different elements of the model will be relevant, or different models will be relevant. Yeah. All right. So I think the two readings are really the Burkina Faso knowledge broker reading. You can take a little more quickly. It's just kind of an example of it being done. There's not that many examples from like middle-income countries. We had were we in the same group? I had an experience with a Chinese researcher, and we talked about knowledge translation with this person. And he said that what you do is you conduct the research that the government has given you permission to do. In his case, he was mapping how close various communities were to health centers and whether it was equitably distributed. Then you present a policy brief to the government, and that's it. The government can do something with it. They can put it in the waste paper basket. But I said, okay, so then what do you do? Like, can you engage the media? Can you engage community groups? He's like, so I think it makes you realize that we are in a good position, that there are a lot of strategies we can take. There's a strong activist world here. There's governments that are receptive to multiple channels. So I was really struck by how the Chinese model was very, very closed, and knowledge translation there is very sort of linear and, yeah. So I just wanted to close with that anecdote about that experience.